Hello and good day all. My name is Tasha. I'm from group 26. So today I'll be talking about the post-operative complications of nausea and vomiting. So PONV complication, it can range from a minor patient discomfort to gastric aspiration or even death. So usually PONV, it can affects approximately around 20 to 30% of patients within the first 24 to 28 hours post-surgery. So this complication, it can be very serious problem. It is often made worse by the medication which are used during the hospitalization. So for example, like in particular, anesthesia medication, it is known for their nausea-inducing side effects. So the combination of surgical incision pain and vomiting, it should be avoided at all costs, as it is very unpleasant and can put a great deal of stress on the patient's surgical side. And now we're talking about the risk factors. So I will start off with the general anesthesia, which is a significant risk factor for nausea and vomiting after the surgery. So if the patients are prone to vomiting after the surgery, the nurse may want to inquire if it's possible for the patient to have a different anesthesia rather than having a volatile gases. So usually the inhale types of anesthesia medication, it is known to cause more chances of having nausea than the other type of anesthesia. The other risk factors is known as the type of surgery. So the type of surgery, it contributes to nausea and vomiting. Minimally invasive procedures, surgeries involving the face and head, abdominal surgeries, surgeries on our urinary tract, and surgeries on the reproductive organs, they are known to have higher rates of PONV than the other procedures. So the other risk factor is involving in terms of gender and age. So in terms of gender, men tend to have nausea and vomiting after surgery less than how female patient does. And in terms of age, a younger patients tend to experience more of this complication than the older patients. So other terms is individuals who are prone to motion sickness, they have a much higher rate of nausea as do as the non-smokers. So the patient who has had a prior bout of post-operative nausea and vomiting with a previous surgery is far more likely to have it than the average patient. So determine a risk factor of PONV. There is a tool which called as APFEL scale. I will write here. APFEL scale. It's often used to determine if a patient is likely to have nausea and vomiting after surgery. So in this scale, there are 4 questions. So the first one, is the patient female? The second one is the patient a non-smoker? The third one is, does the patient suffer from any motion sickness? And the last question in this scale is opioid pain medication part of the recovery plan? So for each yes answer, the patient is given a point, with 4 being the maximum number of points. So a patient with 1 point, they has a 10% chance of post-operative nausea and vomiting, while a patient with 4 points, which is a maximum point, they have 78% chances of having PONV. So how will this score help? So this score will help the anesthesia provider to decide if preventative medication should be given during or immediately after the surgery. So if you as a patient are having having above 2 on this scale, you might want to let your anesthesia provider know that you are at risk for nausea and vomiting after surgery. That's all about PONV. Thank you for listening.